WS Hospital was struggling to successfully manage grow. One of the very challenging areas is managing patient paper medical records. WS Hospital still reliant on physical records like charts, forms, and X-rays to gather and store information about patients. There are voluminous patient records and a myriad of administrative and insurance forms. Processing and managing these records wastes valuable clinical and administrative time. This makes it nearly impossible to effectively share information. It also requires physical space allocation for storage, which is very costly. WS Hospital was facing 4 major specific challenges. First, WS Hospital is now receiving about 2,000 outpatient visits per day. And the effort of managing and tracing paper medical records was rising exponentially with the increase of outpatient visits. Second, the time of making a patient medical record available at any outpatient clinic is not less than 25 minutes after the time of patient arrival at outpatient reception. This delay is directly affecting the clinic flow and wasting time for patients, physicians, and nurses. Third, clinic nurses are heavily loaded by handwriting patient basics demographics on each patient visit sheet of the medical record. This heavy paperwork load is consuming more than 50% of clinic nurses' time. Fourth, to fulfill insurance requirements, regulation compliance, and quality policies, the physicians have to fill certain forms and repeat filling the same data in different forms. This waste of physician time directly affects the number of patients serviced in each clinic. Hospital's board of directors responded to this challenge by forming a committee with members drawn from medical records, outpatient, and IT departments. The board set 4 key objectives for this committee. First, force the paper medical record delivery time at all clinics to be less than 15 minutes. Second, implement a software solution that allows clinic nurse to retrieve patient data entered by outpatient receptionist without re-entering it, and to immediately start collecting and entering patient medical factors without waiting for the arrival of paper medical record. Third, make patient data entered by clinic nurses available at physician computers and free physicians from most of repeated paperwork, and at the same time, encourage them to use available computer drop-down menus of symptoms, diagnosis, medications, and the other investigation orders. Fourth, develop and implement a new medical records management process to easily track and document all medical records movements with assigned responsibilities. To achieve hospital board's objectives, the Medical Records Committee contracted Webisoft's independent software provider to supply and implement their medical records solution, which is a part of Webisoft Hospital Management Solution, WebiHIS. Webisoft Medical Records Solution helps medical records department staff, physicians, nurses and other authorized users to manage paper medical records activities, such as issuing medical records requests, receiving requests, retrieving and preparing records, records out, records in, sorting, scanning and electronically storing, retrieving, reporting, etc. Webisoft Medical Records Solution enables outpatient reservation department to automatically schedule a medical record request to make it available at the medical record sending area before the patient appointment time. Once patient arrived at the hospital reception, the outpatient receptionist is now able to automatically issue a medical record movement request to the selected clinic. Once patient arrived at the clinic nurse does not have to wait for the arrival of paper medical record. She retrieves patient available data and starts directly entering the new visit medical data. When the paper medical record arrives at the clinic, the nurse consolidates both computer-entered data with the paper medical record and makes both available for the physician. The physician is now free from most of the paperwork and can use available physician computer screens to select symptoms, diagnosis, medications, and the other investigation orders, and at the same time can add minimal information on the paper medical records. After implementing Webisoft Medical Records Solution, all medical records movements were stored in a computer movement profile, which facilitates medical records tracking, and at the same time, ensures personnel responsibility for each movement. Average medical record delivery time was decreased to 12 minutes and the tracking time is one-click time. Meanwhile, the patient and nurse wait time was decreased by 40%, and the physician paperwork time is decreased by 20%.